Okay, so next question is which component of the bacteria spore is responsible for their resistance to heat and chemicals? Answer is diplocholinic acid. Next one is which of the following antacid or acid reducing agent is cytochrome P450 inhibitor? That is cimetidine is cytochrome P450 inhibitor. Next one is 45-year-old woman present with right upper quadrant pain, jaundice, pruritus. There is elevated ALT and AST. What is most likely explanation? It is obstructive biliary pathology is most likely the uh, uh, pattern for cholestatic pattern like increased ALP and ALT ratio. So obstructive biliary disease, in obstructive biliary disease there is increased ALP and AST ratio. Okay, so as you can see in this image, there is obstructive jaundice in which there is obstruction of biliary flow and increased conjugated bilirubin in the level, which is bound to in the liver, which is bound to the albumin, and increased ALP AST ratio will be there, and there will be clay colored stool. Patient will have pruritus, right upper quadrant pain will be there to the patient, and then the patient will have a lot of pain and jaundice in obstructive pattern. A raised ALP and AST will be there. Okay, so you have to keep in the mind that when the patient has right upper quadrant pain and patient has pruritus with jaundice and labs and LFTs shows raised ALT and AST is indicative of obstructive biliary pathology. So this is a very important finding that you have to keep in the mind. Obstructive biliary pathology is the answer. Next one is a 30-year-old woman present with fatigue, constipation, weight gain, no change in the diet, and patient feels cold all the time, and patient has physical examination shows dry skin and delayed reflexes relaxation. What will be the answer? Answer is delayed reflexes and weight gain is indicative of hypothyroidism. Hypothyroidism is the answer, suitable answer. Next one is 28-year-old woman diagnosed with Graves' disease, and there is started of carbimazole. 6 weeks later, she presented to the physician for positive pregnancy test. Which of the following most appropriate changing for this? Now, a pregnancy patient has a first trimester because she has she has been found pregnant recently, so it is first trimester. We have to give propylthiouracil in first trimester, so we will have to switch the propylthiouracil because methimazole is given in the second trimester. Propylthiouracil is given in the first trimester. So this is the thing that you have to keep in mind. Next one is 32-year-old woman present in the HIV with dysphagia. Endoscope shows white plaque lesion at the esophageal mucosa. Biopsy reveals septate hyphae, that is esophageal candidiasis in HIV patient. Esophageal candidiasis is more common in HIV patients. Next one is a 29-year-old woman present with a dysuria, suprapubic pain, urinalysis shows WBC leukocytes, raise positive nitrates, gram-stain reveals gram-negative bacilli. Which organism most likely causes gram-negative bacilli? Most likely cause is E. coli is the answer for this clinical presentation. Escherichia coli for gram-negative bacilli. Next one is a patient present with wasting of thenar muscle, sensory loss of lateral two and half of the finger and the palmar surface. Which nerve is most likely involved? It is median nerve. Median nerve is most likely involved with the wastage of thenar muscle. Next is the patient sustained fracture of distal medial condyle of the femur. Which structure In the popliteal fossa, most likely riskate the fracture of the medial condyle, that is popliteal artery. Popliteal artery can be fractured, artery can be damaged in medial condyle, damage of the femur. Medial condyle damage of the femur. Next one is